It's Thursday, January 6th. This is the news on PBCJ. I'm Simone Absalom Gale. The Times of India rated Jamaica as one of the safest travel destinations globally. This is based on the latest United States State Department and Centers for Disease Control and Prevention guidance and data from the 2021 Global Peace Index, which ranked more than 160 countries worldwide in many categories. The Times of India is an English-language daily newspaper in India and is that country's third most popular newspaper and the world's best-selling English-language daily. The Tourism Minister Edmund Bartlett attributes Jamaica's ranking on the list to the highly effective tourism-resilient corridors, which have a 0.1% infection rate. The publication noted that the island has a Level 2 travel advisory from the CDC and the State Department. This means that visitors are to exercise increased caution due to COVID-19, while the CDC indicated that the island's borders might witness a moderate rise in coronavirus cases. The United Arab Emirates, British Virgin Islands, the Bahamas, Fiji, New Zealand, and Grenada are also on the list. Prime Minister Andrew Holness says Jamaicans should be wary about misinformation regarding the government. He gave the caution while he addressed Wednesday's National Day of Prayer function at the Power of Faith Ministries in Portmore.
Timothy 4:3-4. For the time is coming when people will not endure sound teaching, but having itching ears, they will accumulate for themselves teachers to suit their own passions, and will turn away. They will turn away from the truth. Have you seen that happen in Jamaica recently? Turning away from listening to the truth and wander off into myths.
Mr. Holness cited the issue of a vaccination mandate as a topic of propaganda in the society. He made it clear the government made no such declaration.
The government has never said that it is going to force anyone to take the vaccine. I just want that to be clear because I have heard it on pulpits before from pastors who sound very convincing, as if to say that, the government is a part of some conspiracy. I want that to be clear. Government is not a part of any vaccine conspiracy. We live in a democracy, so the rights and freedoms of the people take priority.
He says there is widespread vaccine hesitancy because people do not have enough information about the COVID-19 vaccines and their effect. However, the government's public education campaign is designed to address the matter. The Health Ministry reported 735 new COVID-19 infections on Tuesday and 4 deaths, which pushes the overall death toll to 2,483. GraceKennedy Group has announced a vaccination policy for its employees, contractors, and consultants to be vaccinated against COVID-19 or undergo regular PCR testing. The group's CEO and government senator, Don Webby, says the new policy is to be phased in and will come into effect on April 29. Under the policy, as of January 14, GKT members will be required to disclose their COVID-19 vaccination status to the company. The COVID-19 vaccination requirement then begins to take effect on February 11, 2022. As of that date, all GK employees, contractors, and consultants will be required to be either fully or partially vaccinated against COVID-19. Then, On April 29, 2022, all members will be required to be fully vaccinated against COVID-19 or be subject to PCR testing every 2 weeks. Information Minister Favour Williams says several contracts have been signed for the provision of security services for a number of government agencies. She says Cabinet ratified a contract for the Port Authority to MZ Holdings Limited
in the amount of $26,872,864.20 for the provision of security and dispatching services at the Port of Ocho Port Ship Terminal and Ocho Fishing Village and environs of the Falmouth Cruise Ship Terminal for the period September 1, 2020 to August 31st, 2021.
A 3-year security contract was also signed for the island-wide locations of Transport Authority.
Cabinet approved the award of a contract for the provision of security guard services to the locations of the Transport Authority for a period of 3 years in the amount of $306,178,668, inclusive of GCT, and that contract was awarded to Marksman Limited.
Jamaica's efforts at catalyzing the global phase-out of lead paint is on track. This according to Poison Information Coordinator at the Caribbean Poison Information Network, Sharika Whitelock-Bellingsing.
Our recent data since August 2021 from the World Health Organization has shown that 43% of the countries in the world have had legal binding laws for lead in paint. And I'm happy to say that Jamaica is on track in upping that percentage for the 2022 calendar year.
Lead is a cumulative poison that can severely impact the nation's health.
One of the main problems that we know about lead is that the impact on children is irreversible. Why is it that after 20 years, we're still having the discussion of how best countries can eliminate lead from their paint? We are knowledgeable about the health burden. We are knowledgeable about the deleterious impact on children in terms of IQ deficiency, impact on learning disability, and also impact on health in terms of functional systems in the body. We're also aware of the alternatives that can be used for paint industry. And we know that these alternatives, they are affordable and accessible.
She was speaking at a recent JIS think tank. Cabinet has given approval for amendments to the bill entitled the Trafficking in Persons Prevention, Suppression and Punishment Amendment Act 2021. That information from Education, Youth and Information Minister Favour Williams at Wednesday's post-cabinet press brief.
The principal act is being amended to deal with fines and penalties.
Approval has also been given for amendments to the Agricultural Produce Act.
Cabinet gave approval for the amendment of the Agricultural Produce Act in order to strengthen and modernize this legislation for the purpose of effectively regulating trade and movement of agricultural produce. Cabinet also gave approval for the consequential amendment to the Rural Agricultural Development Authority Act to empower the Rural Agricultural Development Authority, to collect payment in relation to the proposed amendments, consequential amendment to the Predial Larceny Prevention Act to make the definition of agricultural produce consistent with the Agricultural Produce Act as amended, and the issuance of drafting instructions to the Chief Parliamentary Council.
The Neonatal Intensive Care Unit at the University Hospital of the West Indies will be receiving $15 million to purchase urgently needed neonatal resuscitators, a bilirubin phototherapy system, medical oxygen cylinders, and personal protective equipment. The Supreme Ventures Foundation has given the commitment of providing the funds through an agreement with the Zane B. Ennis Foundation. According to SVF Director Heather Goldson, the foundation hopes to continue working with healthcare facilities to improve the country's healthcare system. Motorists will have to pay more at the pumps for gas and diesel this week. We get this plus other latest market updates and insight in this quick business report with Gabriel Thompson.
According to the latest ex-refinery costs from Petrojam effective Thursday, January 6, motorists should pay more at the pumps for gasoline and diesel. 87 and 90 octane gasoline will be sold for $167.42 and $172.87 per liter respectively, up by $2.42 and $2.43. Automotive diesel fuel is up by $1.93 and will be sold for $162.42 per liter. Ultra-low sulfur diesel is up by $2.32 and will be sold for $168.42 per liter. Kerosene saw a $1.27 price hike and will be sold for $138.80 per liter. Propane liquid petroleum is up by $1.50 and will be sold for $70.74 per liter. Butane liquid petroleum will be sold for $80.59 per liter after an increase of $2.56. Be on the lookout for price changes as marketing companies and retailers will add their markup to these prices. In foreign exchange trading for Wednesday, January 5, the US dollar sold for an average $154.84. The Canadian dollar ended trading at $120.87. The pound sterling traded for $210.77, and the euro sold for an average $178.75. In Wednesday's trading session, the JSE Combined Index advanced by 2,459 points to close at over 400,000 units. Overall market activity resulted from trading in 96 stocks, of which 43 advanced, 33 declined, and 20 traded firm. The Junior Market Index advanced by 24 points to close at over 3,000 units. Stocks advanced for 1834 Investments Limited, Blue Power Group Limited, and Caribbean Assurance Brokers Limited. Stocks declined for Barita Investments Limited, Berger Paints Jamaica Limited, and Cargo Handlers Limited. Trading firm were 138 Student Living Jamaica Limited, AMG Packaging and Paper Company Limited, and CAC 2000 9.5% preference shares. Sagicor Select Funds Limited Financial was the volume leader with over 2.2 million units, followed by Cargo Handlers Limited with over 960,000 units, and Trans Jamaican Highway Limited with over 900,000 units. In market data for oil, prices lost ground on Thursday, falling more than $1 a barrel from their highest levels in more than a month after U.S. fuel stockpiles surged amid declining demand. The global benchmark Brent crude futures fell $1.12 or 1.40% to $79.68 a barrel. West Texas Intermediate crude futures lost $1.04 or 1.3% to $76.81 a barrel. U.S. crude oil stockpiles fell last week while gasoline inventories surged more than 10 million barrels, the biggest weekly build since April 2020, as supplies backed up at refineries due to reduced fuel demand. In today's edition of the Bank of Jamaica BOJ Empowering You video series, the question is asked, why should you save with a regulated financial institution? It is safer because Bank of Jamaica regulates financial institutions like deposit-taking institutions. Plus, people who save at a DTI get deposit insurance coverage. If you are worried about whether or not to keep your money at home or in a bank, watch this.
Hi, honey. Today was a day and a half.
You ready for dinner?
Not yet. But I have something for you. The first deposit for the saving plan, $200,000.
Cash? Why you bring cash, David?
So we can save it under the mattress?
Under the mattress? You couldn't be serious.
Plenty people do that.
Once upon a time. But nowadays is not a wise thing to do. It's too risky. You must save your money in a regulated financial institution.
What's the big thing, Joy?
Suppose somebody broke into the house. Or suppose there's a fire.
Here where you gone now.
Just listen to me, darling. We're saving at a financial institution. It's safer. Furthermore, Bank of Jamaica and the Financial Services Commission supervise regulated financial institutions like deposit-taking institutions. And you want to hear the best part? People who save at a deposit-taking institution get deposit insurance coverage.
Ah, very interesting.
And with that, we close this Thursday edition of the Business Report inside the news on PBCJ. I'm Gabrielle Thompson. Pleasant viewing.
In regional news, we begin in Trinidad and Tobago. The Ministry of Health has already placed an order for the pediatric version of the Pfizer COVID-19 vaccine and will get supplies once it is approved for use by the World Health Organization. More from TTT Live.
Mr. Terence Dialsing said if approved, the pediatric version would be different to the current stock of Pfizer that is in this country.
Have to wait for the EUL or EUA approval for the pediatric version, where the dose is different, the buffer is different, the packaging is different. What I can tell you and tell the country is that we have not been standing still on this issue. We have already placed orders for the pediatric version.
Meanwhile, Chief Medical Officer Dr. Roshan Parasram said there has been a slight uptick in pediatric cases at hospital and they will continue to monitor those numbers.
What we have noticed over the last few days, we actually have 8 pediatric cases in hospital today. One of them in a is critically ill in ICU. So we note it as a concern on the back of Omicron and looking on as what is happening in the rest of the world. The pediatric cases are filling up the hospitals in the US, for example.
And still in Trinidad and Tobago, Health Minister Terence Dialsing is claiming that COVID-19 positive patients are paying up to $30,000 to be treated with ivermectin and oxygen at home. He is warning against this practice as he believes it could be even contributing to the number of daily deaths being reported. Sunil Lala reports.
And people are dying at home after paying these huge amounts of money for something that is no better than snake oil. That's the best way I could describe it now.
There continues to be a reliance on the use of ivermectin, according to Health Minister Terence Dialsing. Speaking at a COVID-19 update on Wednesday, he says frontline doctors asked him to raise the issue again, since they say people are shelling out big money to be treated at home with ivermectin.
You have persons who can afford it. This is the information coming to me this morning, who are paying up to $30,000 to be treated at home with ivermectin and home oxygen. What the doctors have asked me to say this morning is that this is untenable. If you are on oxygen at home, we ask you to come in to a facility to get oxygen. And there is no need to spend $30,000 on ivermectin at home.
The minister also continues to warn against the use of purchasing COVID packs which he says will not assist in improving one's health to fight COVID-19.
Which has a combination of ivermectin, vitamin B, and vitamin C. That is not going to assist you. And it is their view that the continued reliance and confidence being placed on ivermectin is contributing in some way or fashion to the number of deaths that we experience.
Mr. Dialsing says the Chief Medical Officer will again write to the Medical Association and the Pharmacy Board about the use of ivermectin to treat COVID-19 patients at home, which he says has no clinical trials showing its efficacy. Sonolala, TTT News.
Meanwhile, 22 additional COVID-19 deaths in the past 24 hours. The Ministry of Health says the persons were 6 elderly males, 9 elderly females, 1 middle-aged male and 6 middle-aged females. 2 of the persons had no known medical conditions. Their deaths take the COVID-19 death toll to 2,973. 579 new positive COVID-19 cases were also reported by the Ministry of Health. Those results were from samples taken between December 31st and January 4th. The total number of active cases is 15,436. 458 patients are in hospital, while 167 are in step-down or transition facilities.
A potential COVID-19 outbreak in one of the schools in Grenada is seemingly driving home the importance of the need for the proper wearing of masks, social distancing, and knowing your status. Reports have surfaced that positive cases among students were recorded in one institution as school resumed this week, days before the full reopening of face-to-face teaching and learning scheduled for Monday. More in this GBN News report.
The Ministry of Education's back-to-school protocol strongly dictates the proper wearing of masks, regular sanitization and social distancing wherever necessary, with updated guidance on quarantine and isolation. These mandates are now being made more relevant as reports of several positive cases among students at one institution are being brought to the fore. The situation was brought to the attention of education officials during GBN's To The Point program on Wednesday.
And I'm asking this, given the fact that there is a situation that's developing, and I pray God that you are aware of it, and then within a school, within the confines of St. George, where up till yesterday, a child which came to school, reported positive with the virus, and my understanding from all my sources is that 2 other children that were tested positive at the school.
Chief Education Officer Angela Finley impresses that as part of the protocols, together with quarantine and isolation, parents are asked to keep children who are feeling unwell at home.
Right. So in terms of that, the magnitude of what you're describing, that has not come to us as yet. But again, I want to go back to the point that I was making, that if the fight against COVID is to be won, it has to be that collaborative effort among all stakeholders. So again, we are appealing to parents that if children are unwell, or if there are persons in the home that are unwell, the guidelines from the Ministry of Health says that no one then should leave home where there are sick persons to go anywhere else.
Finley says isolation for students who are in direct contact with another student displaying symptoms and not wearing a mask is the requisite guideline. Education Minister Emily Pay adds that there are protocols to be followed in such a situation.
The principal has protocols to follow, right? So on entry, every child should be sanitized. On entry, every child should be wearing a mask, right? And the principals are aware of what do they do if a child is not wearing a mask. You should not even be accepting that child, or you should be finding a way of providing or supporting or getting help from the ministry in that regard.
Minister Pierre notes that once the school is aware of the student being positive or displaying any symptoms, there are communication lines to follow.
Immediately contact the parent of that child. Immediately isolate. Immediately ensure that that child is removed from the compound. And there's some line of communication now, communication with the Ministry of Education. So it appears that that school has not communicated based on what the CEO said. Communication there is important. Engaging of Ministry of Health is now important.
The Education Minister points to other situations in which positive cases were reported in schools and students, teachers, parents and others were called in for testing. I am Gerard Joseph for GBN News.
In sports, the West Indies women's tour of South Africa has been revised and will now consist of 5 matches, including a warm-up contest for 4 one-day internationals, as they finalize preparations for the ICC Women's Cricket World Cup. Cricket West Indies made the announcement on Wednesday. It added that all matches will be played in a biosecure environment at the Imperial Wanderers Stadium in Johannesburg, a venue which CWI said is close to the team's hotel, which has been secured for exclusive use due to the ongoing novel coronavirus pandemic. West Indies women were previously scheduled to play 3 T20 internationals and 5 ODIs against South Africa women from January 15 to February 6. But in the revised schedule, the team will play a warm-up match against South Africa XI on January 25, followed by 4 ODIs, 2 two-day matches and 2 day-night matches under lights against South Africa women from January 28 to February 6. And that's our package. You've just watched the news on PBCJ, the People's Station.